military for weeks and weeks. But first, I've been warning for weeks and weeks to keep an eye on the coronavirus that's spreading from China to countries around the world. My concern was that I didn't trust what China was saying about it. And some breaking news to report on the virus tonight. The U.S. military just announced moments ago that one of its soldiers based in South Korea did test positive for this new virus, the first U.S. service member to be infected. Now, I'm going to take you through how all this unfolded today. At roughly noon, with the president out of the country, the CDC began sounding this alarm.
Disruption to everyday life may be severe, but these are things that people need to start thinking about now. People are concerned about this situation. I would say rightfully so. I'm concerned about this situation. CDC is concerned about this situation.
Well, and in India, with the markets, the president was in India, obviously, and the markets plummeting because of the coronavirus spread, all of that accelerated.
Outbreak in China. Sports events are at a standstill in many areas of Asia. One case has now been reported in Brazil, the first in South America. And in the last few hours, Greece has joined the grim list of 39 countries with patients suffering from COVID-19. Well, several other European nations, including Austria, Croatia and Switzerland, have also announced cases. All appear to be linked to this growing outbreak we're seeing in northern Italy, around the city of Milan. So let's take you straight there. We can go live to our correspondent Bethany Bell, who is in Milan for us. Just bring us up to date with the situation where you are, Bethany.
Well, within the last hour, the authorities have said that the number of cases of coronavirus here in Italy has risen to 374, and there are now 12 confirmed deaths because of the virus. What we understand is that those who have died were elderly or who also had underlying health conditions, and doctors say that the elderly and people like that are particularly vulnerable to this, as they would be in cases of influenza. They've also reported that 4 children have also been infected with the virus, and the first time that we understand children have been involved in that. Meanwhile, there are a number of towns just south of Milan affecting 50,000 people that are still under lockdown, in quarantine. That's where the outbreak is believed to have begun, but the authorities are still trying to find out what happened there. The Italian Prime Minister Giuseppe Conte has suggested that the hospital in the region may not have adhered to the right protocols in handling the first cases.
Bethany, what is the atmosphere like in northern Italy? How are people responding to all of this?
It's subdued. It's uncertain. People here in Milan, of course, are going about their work.
Serious disruption. We're joined now by Bloomberg opinion columnist Max Neeson. It's not a question of if, but when, Max, apparently. And, you know, obviously, if there's an outbreak that gets out of hand, it will stem panic. How does the president and government officials stop that from happening?
So I think what really needs to happen is that the messaging from the Centers for Disease Control and from the president and others in his administration needs to be cohesive, needs to diminish the incentive to prepare. That's likely to have a negative impact on how far this disease actually travels. It's time to, if not panic, at least get this conference.
Max, CDC funding has been cut. Does it have the resources it needs?
Not yet. So the administration is suggesting kind of a stopgap funding package in the realm of $2.5 billion. But the U.S. Senate, Chuck Schumer from New York, is suggesting that it might need something closer to $8.5 billion. Which number is going to get the job done really depends on how rapidly and how far the virus spreads in the United States, if it does. But, you know, if there is really sustained community transmission in multiple parts of the country, it's going to need more than that $2.5 billion. The Schumer number might look better as we look to kind of, you know, fund state efforts throughout the country, you know, continue to fund vaccine efforts at the level they need to be. After years of cuts, there's a lot of catch-up to be paid, not just for this outbreak, but for future outbreaks as well.